right, class. My name is Dr. Perez. We will be starting with our demonstrative examination today. For today's demo, we have Sandra, the frequent model and volunteer for the clinic. She will be helping us demonstrate a regular pediatric examination. So we'll be going over some of the differences between an adult examination and what we would do for someone between the ages of, I'll say, 4 to about 10 years old. Otherwise, we would modify for someone quite a bit younger and then someone just a little bit older into adolescence. Okay? So we also have Bruce in the office this morning. He is our therapy cat, and we will be kind of allowing him to come in and out as he pleases. And we're going to go ahead and jump right in. We have quite a few things to go over today. So does anyone have any questions before we get started? No, and we're all taking notes. Okay, all right. All right, Sandra, so do I have your consent to go ahead and proceed with the examination today?
Yes.
Okay. I've kind of explained to you beforehand that we'll be going over what we would demonstrate for a pediatric examination, so something we would perform on a child. I will be having you answer to the best of your ability. I'll be showing you some variables between what we would do in a standard exam, which we've performed with you before, versus for a child. So I have a couple different props that we'll be switching back and forth from. Okay? All right. So let's go ahead and begin. I am going to start with the very basics. So let me just grab a standard check-in that we would use on an adult patient. Now, typically, if you are performing a pediatric examination, you would have a parent in the room with you. That is my preference. Some children can be particularly shy, or they might just be too young to know how to answer the questions appropriately, in which case having either parent or guardian in the room is very helpful. Okay? Now, obviously, Sandra is an adult and she is capable of speaking, so we will do just a regular intake with her very briefly. So if I can just have you confirm your name for me, please.
It's Sandra.
Thank you very much. And if you can just confirm the reason for your visit today is just a general checkup?
Yes.
Okay. Now, for example, if this were a standard pediatric exam, it would look something like, Mom, Dad, parent, or guardian, can you please confirm the name of the patient today? They would then state the name of the child, and then I would ask for the reason of the examination, in which case they would state it was a general pediatric exam. If the child is old enough, you can ask them, do you know why you're here? Can you tell me where you are? And they may be able to state that they are at the doctor's office. Okay? All right. Okay, so we are going to go ahead and jump right in. I have a couple things that we're going to be going over. This is going to function very similarly to a regular kind of standard upper body head to toe exam. Okay, so we would start typically with vital signs. Now, our patient, either Sandra or a pediatric patient, would have their vitals taken usually by the medical assistant or the intake nurse. So we will assume that Sandra's vitals have already been taken. I will, however, demonstrate to you the differences between a couple tools that would be used to obtain vital signs. So, for example, Sandra is in to get her preliminary vitals taken. I have an adult blood pressure cuff here. Everyone should be familiar with this at this point. We've used this several times. Okay, now to show you quite a significant difference here, I have a pediatric blood pressure cuff, obviously quite a bit smaller. This is actually for a newborn, so you will see various sizes that go up until you get to the largest adult size. Okay, placement is the same. Same thing with our temperatures, depending on the age of the child. Infancy, we normally take a rectal temperature, in which case you would use a disposable, obviously insert, and then you would dispose of this afterwards. For children that are just a little bit older, you would use a regular oral thermometer, and then of course, a disposable sleeve. And then we would place it under the patient's tongue, obtain the temperature, and then obviously dispose of the cover. Now for adults, adolescents into their preteen years, as well as someone Sandra's age, we would use a regular temporal thermometer, in which case we just test at the normal forehead site. Okay? Sandra, don't worry, I will not be testing a rectal temp on you this morning. Just giving a bit of a demonstration here. So aside from blood pressure and testing for temperature variation, we would typically also test for oxygen saturation. Okay, so we can do that a couple different ways. Some clinics have just the finger probe. Mostly what you'll see is this device here. So for the adult examination, this is just going to go on Sandra's index finger, and then obviously you would plug this into your Dynamap or to your vital signs machine if you're in an office that has it on the wall. Now for a pediatric exam, it is slightly different. So this is a neonatal pulse oximeter. And how this works is that you would either apply it to the patient's wrist or to their finger. So you could apply it to the finger and then wrap it around as such, and you would again plug it into either power source. Now if your patient is quite a bit smaller, you would then apply it to the wrist. In some cases, especially in the NICU, you might see it applied to the ear or even the forehead. Okay? All right. Take that from you here, Sandra. And I did get a report back that Sandra's actual vital signs were normal, within normal limits today. Okay. All right, so let's go ahead and put these tools away and we can move on to the next portion of the examination. Now, specifically for a PEDS exam, measurements are very important. Obviously, children grow pretty significantly. The most rapid rate of growth is between the ages of 1 and 5. For children, it is important that we measure the cranium, circumference, length, things like that should be well documented so that on their annual visits, we can document that they are growing according to the normal growth charts. Okay, so to demonstrate that, we will say that Sandra is our child and we are measuring head circumference here, as well as neck. And if you're doing a complete examination, I would also recommend doing a full height as well as limb difference. Okay? All right. That is a good question. Okay, so Stephanie wants to know how you would know what the average should be or whether or not the child is within normal range for height and weight. So typically you will have a chart in the office. If you're in a PEDS office, there should be charts on the wall. If not, it is something that you will become familiar with as you continue. I think I only have a couple of you that are actually interested in doing PEDS. If that's your specialty, you will kind of become almost have it memorized by the time you're actually performing the examinations. If not, with any other adult examination, there are materials that you can look into. Okay. You will get more questions from parents for sure, asking if their child is within normal limits. So that is something that I would try to memorize. Now, at this point, if we were performing an examination on an adult, we would go ahead and do a bit of a cognitive assessment. Same thing for a child. So many of you should be familiar with this. We have used the stroke scale several times. So typically I would ask our patient to name something that they see abnormal here. So Sandra, if you can just choose one item that you would deem to be abnormal in this picture.
The water.
The water, okay. So the water overflowing obviously poses a risk. I would then flip this over and have her point to items that she could maybe name to me. Now, a child of a particular age may be able to name a few of these things. So, Sandra, if I can have you point to an object here and just tell me what it is.
This is a glove.
A glove, very good.
And a chair.
And a chair, good. So I would then test her reading comprehension and I would have her read a few simple sentences. Depending on the child's age, you may use the word list instead. For example, a child age, 6, 7, 8 should be able to read this word here for you.
Mama.
Good. And here.
Tip top.
And here.
Thanks.
Older children, if you're looking at the ages 10, 11, 12, obviously you can kind of move up and just use your best judgment. Aside from stroke scale, depending on the facility you are at, you may have something that's a little more pediatric friendly. So For today's demonstration, I have something that obviously is made for coloring. It is hospital geared and it's geared more towards pediatric patients. So I would have our patient look at this picture here and tell me if they see anything. So do you see anything? Does it look like anything's wrong with our bear?
He's got a broken leg.
He does have a broken leg. Very good. And can you tell me what it looks like he broke his leg on? What is this?
That's a skateboard.
That is a skateboard. Very good. So just testing situational awareness. Again, obviously gear it towards the appropriate age range that you're working with. Okay. Very good. All right. So we are going to go ahead and move on now. One of the next things I like to do is have a look at our patient's eyes. I typically try to get the lighted exams over with closer to the beginning of the exam, okay? So they tend to be just a little bit more uncomfortable. So you would check a pediatric patient's eyes just as you would as an adult. So for this examination, I'm just going to be checking it as normal with my ophthalmoscope. So Sandra, I'm gonna be coming really close to your face. I'm gonna shine a light in your eye. It is very bright. I don't want you to look at the light. Okay, so we're just gonna look away and I'm just gonna come in here. With children, you obviously want to attempt to make this examination as quick and smooth as possible. So I'm gonna quickly shine. Sandra, I'm gonna touch your face here. I'm just looking at your eye. Very good. Very good. Okay. Now, can you see this light here?
Yes.
I'm going to hold your face for you. I want you to try to follow the light with your eyes. Now, this test might be slightly difficult, again, depending on the age of the child. I find over the age of 5, they are able to follow command enough to where you can perform this test appropriately. If the child is a little bit younger, you can hold their face and just try to grab their attention here while they will kind of subconsciously follow your hand. Okay? Now, if we were moving on to an otoscope examination and where we're testing ears, nose, and throat, you're going to use the same otoscope head that you would use for an adult examination. Excuse me while I fumble with mine. I did, however, want to show you the differences between a regular adult examination and a pediatric examination, okay? You do not want to use the same size tip that you would be using for both exams. They are not universal, as obviously a child's anatomy is quite a bit different. So here you can see the difference between an adult and a child ophthalmoscope tip, okay? So obviously for Sandra, I'm going to use the adult size, and then you would just modify depending on the age of your patient. All right. Sandra, I'm going to have a little look in your ears. Have you been having any trouble with your ears? No. Does it hurt? Okay. So let's turn our head. I'm going to turn your head that way. Come in real close. You're going to feel me pinch your ear just a little bit. Good. I tickle a little bit. Looking at your earwax, everything looks okay. And I'm going to look at the other side as well. Do your ears ever get itchy?
Sometimes.
Sometimes, okay. That looks okay. So we're also going to have a look in your nose, okay? Just looking for any boogers, see if there's anything that shouldn't be there. That looks good. Can I have you open your mouth? I say, ah. Stick out your tongue. Very good. Okay. Now, obviously, you want to modify use of language and medically appropriate words depending on the age of your patient. So if you're talking to a child, the ages of, 4 to 10 years old, you're not going to describe things in a way that's medically accurate because 1, it's scary, and 2, it doesn't make any sense. So use language that is appropriate to the person you are working with at the time. Okay? All right. So we are going to keep going. Now, at this point, we would typically test for visual acuity. Now, on an adult patient, obviously that would look something like a Snellen chart. Again, depending on the age of your patient, use your discretion. Typically, patients over the age of 5 are able to read letters, alphabet, simple words. We do have modified examinations that have shapes, so you might see a boat, a house, a car, that kind of thing, instead of letters. You can also do numbers, you can also do shapes, circles, squares, triangles, that kind of thing. So same examination, same font size, just a little bit of a different graphic so that it caters more to the age of your patient. Okay, so Sandra, I'm gonna have you read this very top letter for me.
E,
And here.
L, T,
Good, and here.
F, P, H.
And can you read down lower here?
No,
No. Here,
no,
and here,
nope.
here.
B, H, J, B, S.
Okay, and what about this line?
That is an O, L, C, and F.
Good. Okay, so Sandra is showing a little bit of a variation. I do know that she wears glasses and she's not currently wearing them. So obviously something to keep in mind, if your patient wears glasses, you would have them put this on for the examination. That includes a pediatric patient. Okay. It's unlikely at a very young age that they will be wearing contacts, but you can ask parents just to make sure. All right. So following up on visual acuity, we would typically test for color deficiency. Now, I know you guys are familiar with the Ishihara test plate. This is a very standardized way of testing for color deficiency. So we would typically point to the chart, testing for red, green, as well as gray color deficiency. We would then have the patient visualize or verbalize what they see visually. Now for a child, I tend to steer away from that as it can be a little bit daunting. They might not understand it, or it could just be too difficult for their brains to kind of materialize that they're seeing two different colors. So I'm going to show you a couple different ways to test this in a way that is age appropriate, starting with the youngest. So I have a couple different things here. Let's say we are testing a patient around the age of 5 years old, 5, 6 years old. I do typically keep stuffed animals in the office. Okay, so it would look something like, Sandra, can you tell me what you see here?
A chicken.
A chicken, very good. And what color does this look like?
Red.
And here?
Green.
And here?
Green.
And do either one of these look darker?
Yes.
Which one?
The top one.
This one here.
Yes.
Very good. And can you tell me what you see here?
A dinosaur.
A dinosaur. I would accept dinosaur, dragon, any sort of mythical creature. And can you tell me what color the belly is?
Purple.
And the head?
Green and purple.
Green
shades.
and purple. Very good. So all of that would be considered an appropriate response to test for color deficiency. Now, if we're moving up a little bit in age range, then I might use something like a colored pencil or a pack of colored pens. So now let's say we're looking at school age, 6, 7, 8 years old. By this age, they're very well familiar with colored pencils. So Sandra, I'm going to point to a couple different pens. I want you to try to tell me what color you see. Okay?
It's red.
Good.
Green.
Very good.
Pink.
Good job.
Blue.
And last one here.
Purple.
Purple. Very good. All right. Doing a very good job, Sandra. We are going to go ahead and move on. Now, I'm going to do a brief test of your hearing. I'm going to check your ears. Do you feel like you ever have trouble hearing?
No.
Okay. This test would be pretty similar for a child or an adult. You maybe would use different verbiage, but for the most part, they should be familiar with the sound. Now, if I were testing an adult, I would ask Sandra to close her eyes and then maybe test her directional hearing, where she would tell me where it starts and where it stops. That may be a little bit more difficult depending on the age of your patient. So I'm going to demonstrate how I would test this in a school-age child. So Sandra, I'm going to test your hearing. I want to see how well you can hear noises, okay?
Okay.
So first we're going to start with your eyes open. Do you hear this sound? Kind of sounds like clicky-clack.
Yes.
Okay. So I want you to tell me when you can hear it. I'm going to cover your eyes with my hand and make the noise, and I want you to say you hear it or say yes. Okay?
Okay. I hear it. 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 I hear it.
Good. Now for directional hearing, instead of asking them to tell me left to right or right to left, I'm going to cover their eyes again and just tell me if they hear it on this side.
Yes.
Okay. And then you hear it on this side,
Yes.
this side,
Yes.
and this side.
Yes.
Very good. Okay. Now, typically school-age children do have their hearing and vision tested, I believe, starting in the first grade, and then every few years they do have an audiologist who comes in and they test basic hearing. You guys might have had the test where you put the earmuffs on and they make beeps in your ears. That is still standard, okay? Moving on to testing peripheral vision. Now I have a couple different things here, a couple different options for a visual occluder. So for an adult examination, we typically would use a standard occluder. Looks just like this. We would place it over the patient's eyes, and obviously one side would be occluded, and then we can test for peripheral vision. Now this does essentially the same thing, except it's just a little more kid-friendly. It has a little face on there. So I'm gonna put this little bear face over one of your eyes, and then I'm gonna show you my hand here, and I want you to just say yes when you see it, okay?
Yes. 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 Yes.
Good, so we're gonna do the other side as well.
Yes. 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 Yes.
Good. Now you could also test this with different colored objects. So if we used, for example, the colored pencils, I'm gonna have you say the name of the color that you see when you see it, okay?
Okay. It's green. Green. Pink.
Good job.
Pink. Pink. Green.
Very good. Okay. All right. Doing a very good job, Sandra. So we are going to continue moving forward now. At this point in the examination, it would be appropriate to perform your stethoscope assessment. So whether we're doing a heart and lung assessment or you're doing both, it looks pretty identical on either patient. So you're going to use your stethoscope to auscultate for both the heart and the lungs. So I am going to go ahead and perform that on you, Sandra. I'm going to listen to your heart and listen to your heartbeat, and then I'm going to come behind you and listen to your breathing, okay?
Okay.
This is just a little bit cold, so I'm just going to give you a warning. Now, obviously, bearing in mind that pediatric anatomy will be much more condensed. Very good. So I'm going to come around the back. All right, Sandra, so I'm behind you. You're going to feel me touch you, and I'm going to listen to your breathing, okay?
Okay.
So I want you to just breathe normal. Okay. So Sandra, I'm going to tap on your back. You're going to feel me tap just like this. When you feel me tap on you, I want you to say teddy bear, okay?
Okay. Teddy bear. Teddy bear. Teddy bear. Teddy bear. Teddy bear.
Very good. Good job. All right. Very good. So we are moving forward with our examination. Now I did want to show you guys a variation between reflex hammers, tools that we would use to test for a pediatric patient. So for a typical adult patient, you would use a standard reflex hammer. I tend to prefer this one in this position just because I feel like it gives it the most adequate reading. So of course, as you know, for an adult, if I'm checking the brachial reflex here, I would have Sandra leave the weight of her arm in my hand, and I would then test for the reflex there as well as at the wrist. We could do the same thing for a child. I would just use a much smaller hammer as we're working with much more condensed anatomy. So it might be a little bit more difficult to find the reflex of a child. I find that adult upper extremity reflexes tend to be more reactive. Lower extremity tends to be about the same. But just to give you an example of size variation, okay? All right. Now we are going to move on to demonstrating what would be a sensory examination. Now, typically for an adult examination, we would start with a soft or dull object that looks something like a Q-tip or a cotton bud. So Sandra, you're quite familiar with this examination. Typically, I would ask you to close your eyes and verbalize to me whether or not you feel something soft. And then whether or not you feel something sharp. I tend to use a Wartenberg wheel for this test, if not the broken side of the Q-tip, just a little bit of a blunter object. I do find that the Wartenberg wheel is a lot more distinct and therefore gives you much more precise answers, especially if you have a patient who's already suffering from some sort of neurological deficiency that is affecting their sensation, okay? Now for a child, they tend to be a lot more sensitive to touch and perception as well as just doctors in general. So I like to use something a little more simple in which I have a modified Q-tip here. So one side is more flat and kind of soft dull. The other side is just a little more pointy than a regular Q-tip here, okay? So Sandra, I'm gonna ask you to close your eyes for me. I'll help you by covering with my hand. I want you to tell me if you can feel that. Do you feel that there?
Yes.
Okay, so we're gonna cover your eyes and tell me when you feel something.
Yes. 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 Yes.
Good, now I'm gonna use the other side. It's a little bit more pointy, but it's not gonna hurt you, okay? It just feels like this. You feel that that's kind of pointy?
Yes.
Okay, so same thing. You tell me when you feel it.
Yes. 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 Yes.
Okay, now we're gonna test to see if you can feel one or the other. So do you feel that this is different than this, or do they feel the same?
Different.
Different, okay. So we're gonna say you feel soft or you feel pointy, and I want you to tell me which one you feel.
Okay. Soft. Pointy. Soft. Soft. Pointy. Pointy. Soft. Pointy.
Very good. So just an example of a little bit of a variation there. You might have some difficulty if the patient is a little bit younger. They may not quite understand the distinction unless there's been sort of an accident where we're really considered about the neurological health. Then just testing for sensation response, I would say, is appropriate. Okay. All right. So moving on to a bit of a neurological examination. So testing our patient's ability to sense objects or stereognosis. For an adult examination, I typically keep a set of tools that I find are appropriate. So obviously you want to use something that you think most people would be familiar with. So Sandra, I would typically have you hold these two different objects in your hand and you would verbalize to me what you feel. Appropriate response would be a carabiner. And I also have one that is identical but quite a bit smaller. So I would then ask what the difference is between the two. Now, it's very unlikely that a child is going to be able to tell you that this is a carabiner. So for school-age children, you might be able to use something like a paper clip or a safety pin. Now for younger children, I like to keep objects on hand that they would more likely be familiar with, and we can test for textural differences, okay? So Sandra, I'm gonna hand you two things. I want you to play with them with your eyes closed and try to guess what they are, okay? Okay, so let's close your eyes. Stick your hands out for me. And what does that feel like to you?
They're rocks.
Rocks, very good. So I want you to open your eyes. Can you tell me how they're different?
One's bubbly and one's ripply.
Very good. Now I'm gonna have you close your eyes one more time. And I want you to tell me, so open your hands for me here. Are these two rocks the same or are they different?
They're different.
Very good. So just testing for textural differences here. So I have two that are similar, not exact, but similar enough, and then one that is obviously quite a bit different. Okay. All right. All right, so we can continue to move on. Now, at this point, I would like to perform a bit of a palpatory assessment, which means I'm going to be palpating our patient, touching for any abnormalities, any lumps or bumps of the cranium, of the back of the musculoskeletal tissue. So typically for an adult examination, I would just use my standard preferred gloves, which tend to be the gray. For a pediatric examination, I do try to make it just a little bit more child friendly. I will usually keep a couple different color gloves and then ask the patient which color they prefer. This tends to just familiarize them with me a little bit more. Children like to have choices, so if we give them a choice, they're less likely to be upset by it, okay? So that would look something like, Sandra, I have a couple different pairs of gloves here. I'm gonna put a pair of gloves on for the next part of your exam. Would you like to pick a color that I wear? I have purple and green.
The green one.
The green, okay. So we will wear green gloves for you today. All right, now I'm gonna be touching your face a little bit. It might be a little bit tickly. I'm just gonna kind of feel around. You can either keep your eyes open or you can close them, okay? I want you to let me know if anything hurts. So I'm gonna start up at your forehead, just feeling around to see if there's anything that I should be worried about. So if you have any bruises or any lumps or bumps on your face, have you fallen down recently at all?
No.
No. Just gonna feel around your neck. I want you to close your eyes for me. I'm gonna feel a rub above your eyes and underneath. Good. Now you can open your eyes. I'm gonna feel your arms. Do you have any pain in your arms?
No.
Good. And no pain in your legs or your feet?
No.
All right, so I'm also just gonna look at your ponytail, okay? You have really pretty hair, so just looking at your ponytail. Do you brush your hair every day?
Yes.
Very good. Okay, so I'm gonna do a couple things. I'm gonna have you make some bunny faces for me, okay?
Okay.
So first I want you to close your eyes really, really tight and don't let me open. Don't let me open. And can you scrunch your eyebrows, make angry eyebrows? Good job. And if you can blow your cheeks out. Very good. And I'll have you smile big. Show me your teeth. Good job. Okay. All of that looks good. So Sandra, I'm going to have you squeeze my hands. I want you to squeeze them hard, okay? Very good. And then can you try to kick me? Kick with your foot. And this side. Very good. Okay. So all of that was normal. Okay. So very normal for strength. Obviously, for an adult, we would check a little bit differently. For a pediatric exam, I would consider that adequate. Now, Sandra, I'm going to take my gloves off. So typically at this time, I would have the patient lie down, preferably with parent in the room, and then we would do just a bit of an abdominal examination, check for any signs of distension. Particularly in younger children, we do find that constipation is pretty frequent. Obviously, we would recommend to parent or guardian that the patient is drinking plenty of fluids, water, watered down apple juice, prune juice, grape juice, that kind of thing can all be very beneficial. Okay? All right, so just to give you guys a couple more options of variation here. So typically for a standard examination, we would have the patient disrobe. They would then put on a gown. We do have pediatric gowns. I would also place a disposable chuck underneath the patient. Depending on the age of the patient, you may also need to keep various sizes of disposable diapers on hand. And then always non-skid socks regardless of the age of the patient. So we do have adult non-skid socks, and I have found a teeny tiny pair of pediatric non-skid socks. Okay. Yes, that is a good question. So Maria wants to know if the patient is required to wear non-skid socks even if they're not able to walk, and the answer is yes, which I know seems quite silly. During a standard examination, anytime we have the patient off of the bed, so let's say there's an, not so much with an infant obviously, but for a child ages, we'll say 1, 2, 3 years old, if we are moving them around, testing any signs of gait, lifting them off the bed for any reason, they do need to have non-skid socks on per hospital policy. Okay? All right. All right, guys. Does anyone have any questions for me as far as the just very brief overview of the PEDS examination? Okay, so I want you all to go over your notes. There will be a quiz, and as we move into the rotation, we will be getting more in depth. All right, thank you.